minutes of our past meeting. I'll entertain a motion.
So moved.
Second.
Are there any additions or corrections? Hearing none, all in favor?
Aye.
Opposed? Minutes are approved. Comments? Who's that?
No new stats were announced, provided all of the dates.
Okay. Behavioral health update?
I'll just kind of hit the highlights like I usually do, starting with staffing. We got through all of our staff spotlights, so I just kind of did a little something different this quarter, listing our staff and their roles. A lot of our staff wear multiple hats. So it's hard to condense it down just to that little space, but it gives you an idea of the staff that we have in our units and their roles. We just had one position open, a licensed treatment professional that we're still looking for a full license in mental health and therapy. I did have a conversation with talk to you, Jessica, about potentially changing some wording that would help give a little bit more interest or help find people or help people find the posting. I'm not sure that's going to make a ton of difference just because it's hard to find those professionals, but we're going to try everything we can. The next page, you'll see referrals. Our referrals did decrease in quarter four, but not unusual, not too unusual for other quarters. I think we will have more referrals in 2025 than in 2024 once we look at the year-end numbers. So nothing real concerning there as far as we need something different from outreach or the needs stuff. Placements, not a lot of change here other than our whole cost placement did end in December, so that of course helps the budget some. We did have 3 individuals that in CCS that are in placement, but those placements cost us a lot less because CCS is covering parent services. We have an additional person that was at the care center in La Crosse for further stabilization, but that placement's being covered by the managed care organization, so no cost to the county. For crisis, there's no significant, I guess, changes or issues with the data as far as number served, the crisis context detentions. It wasn't particularly good or bad quarter, it's just kind of status quo in crisis. We did have 2 crisis collaborative meetings in quarter four. Attendance was a little lower than usual. I noted who was present for those meetings, but sometimes around the holidays it can be difficult for people to get to meetings and that sort of thing. But we continue to invite all of our partners that touch crisis and emergency detentions. We did work on a grant application that I'm sure Brandy will tell you about later in the meeting. We did receive 3, I think, letters of references, one from the hospital, one from the city of Black River Falls, and one from the Sheriff's Department, just to help support our efforts and obtaining that grant, which is about $100,000 that we want to do some outreach to the community, help with crisis follow-up costs and that sort of thing. For case management, again, kind of status quo, not a lot of big changes there. We didn't see a lot of interest in ARDA case management in the quarter. We just had one individual that came through, but didn't follow through with residential treatment or other services. And then no changes as far as Chapter 51 commitment individuals. The outpatient clinic, we did some outreach. It was actually at the end of the quarter, beginning of this quarter, to children and families, to the other clinics in the county. I'm trying to think, there was Another, some of our staff that have youth in the CPS program, we just let them know, Autumn, who is a therapist in our clinic, had some openings. So we saw a big influx of referrals now to fill those spots. Other than, I noted that we still really need that licensed treatment professional because we do have some individuals on our wait list, but they're primarily individuals that have Medicare and private insurance, whereas someone with a training license cannot bill. For CCS, not a whole lot of changes. Our numbers went down just slightly as far as the numbers served within the quarter. We could use some more adult referrals, and not that we don't receive them, but what we see on the adult side more than we see on the youth side is that there's a lack of follow through. We might be able to get them screened, but then to get them actually admitted and go through that process and the assessment phase, it can be difficult to keep them interested and engaged.
Is that because parents on the youth side are pushing through?
I think, yeah, we have a lot more supports in place. Yeah. It's really a lot of work is done with the parents versus the youth, although they need to be a part of that process. And we just don't have that on the adult side as much. I did outreach to the Ho-Chunk Nation Clinic and the Black River Healthcare Clinic at the end of the quarter, beginning of this quarter, just because we're hearing more from the state that if someone is in CCS, all of their services have to be provided through CCS, meaning if they're in CCS with us and they go to the Black River Healthcare Clinic that isn't contracted, there's a potential that Medicaid won't pay for that service or might not pay for our services. It's not really clear. We've never been denied payment when that's happened, but they're really pushing that all of those services be provided through CCS. So there's some concern about that because we have a lot of our youth and adults that go to the Ho-Chunk Clinic or go to the Black River Healthcare Clinic, or they were Crone and now it's merged. So they have not been interested in contracting previously when we've asked. There's more work that goes into it. It's not as easy as, it doesn't fit into the process that they usually have for billing for services. So I did outreach to them. Both were agreeable to have another conversation about it. So we're working on setting that up later this month or early February. It would be Jackson County Behavioral Health, La Crosse County, and then the two clinics because all of that contracting goes through La Crosse. So that kind of complicates things a little bit too because they don't have the relationship with La Crosse. So we're hoping to kind of talk through that process, the why behind there's the benefits, because we get referrals from them. They want individuals that they serve in the CCS program. Well, we wouldn't want to have to end that therapeutic relationship just to go into CCS. If they get contracted, those therapy services could continue. For CLTS, I usually say this every quarter. It's the most we've ever served in a quarter. We served 130 youth. We had an increase in admissions in quarter four. Just constant, I guess, referrals to that program, transfers from county to county, and then changes. It's constant change within that program. You will see in the next page that our average wait time did increase a little bit. And I just gave some explanation down below on why that was. There's a lot of factors that go into that calculation that the state does. We're still within the expectation of 90 days from referral to admission. But things, I guess, cause some issues with trying to get admissions into the program. So if a parent isn't engaging with our staff to schedule the admission, or in one of the cases that I had mentioned, the youth was residing in another county. They started the referral process and the screening process, and it didn't get transferred to us until after they moved. And so we kind of inherited their wait time when it wasn't really Jackson County that had, took that long to screen and admit. So questions about that? It's kind of a complicated process.
So do you think just that we are closer to Clark and Trempealeau in reality for wait time, or, if that number is skewed?
Yeah, I would definitely say that
more in the
we're usually, I
3 to
think
4 weeks.
before I updated, it was like around 40 days. Or a little less than that. I can't remember from quarter 3, but the benchmark is 90 days. So we're not even close to that. It's just a little bit more than we're used to, or that we would like.
Looks like.
And so then you start digging, well, why was this? Well, then there was this issue and that issue that it just happens within that reporting period. There's a couple different scenarios that made that number increase that we had up, that was outside of our control.
Yeah.
Benchmark of the state?
Yeah.
Or surrounding like-sized counties?
No, the state expects counties to have a youth admitted in the program 90 days from the referral date. And they track that through PPS and different systems. They can pull all that from the functional screen system. They can pull those dates. And then they look at it, I think it's a 6-month look back period. So the last numbers were taken in November versus the last 6 months. DST, no significant changes there. The Birth to 3 program had an audit. Well, I shouldn't say, they had an audit earlier in the year, but didn't get the results until this quarter, and they got a 95.5%, which indicates fully met standards. So I'm pretty excited about that. And then I noticed that our referrals took a dip in quarter 4. And not having the Birth to 3 program very long and talking to Nikki, it sounds like this isn't unusual. A lot of the child development days are earlier in the year, maybe while child checks are before school, or I guess Birth to 3, they're not in school, but earlier in the year. So it's not uncommon for this to happen. So I guess we're just going to kind of continue to monitor it. She definitely is doing outreach, and I think we're doing outreach as a group now in behavioral health for Birth to 3. She went to the child development days, so we'll just kind of monitor the referral number. For the community support program, lots of changes with that program, and just mainly staffing changes. Their case manager had moved away, so we have new case manager. The nurse who is shared with La Crosse is taking another position, so she'll be done. The mental health tech is going to, as it was done at the end of the year. So they're looking for a nurse and a mental health tech. They're able to pull in help from La Crosse because they do share staff. So they're able to maintain, but again, if anyone knows anyone, a nurse, it would be part-time position in Jackson County, and then a mental health. I think I had mentioned here that we're going to see some changes with the licensing for the CSP program. And we got some more information on that in the last few weeks. So our team, mainly Steph and I, will be working on transitioning that license from the Family and Children's Center to the county. There's, I want to say, about 10 or 12 counties that are going through this process. Some counties bigger than others, like Milwaukee, Dane, have a big transition ahead of them because they've had multiple providers, and they're trying to figure out how does that look now. Where our county has just had one provider at Family and Children's Center, but there's a lot of things to figure out. How is that electronic medical record going to work? How is the billing going to work? How is the staff credentialing and training and all of those records going to be monitored and kept up to date? Is that us? Is that them? So a lot of questions. The expectation is that we have our application in within 6 months to the state. And then from there, it will depend on the type of transition for each county. Some counties might have a faster transition of a few months. Others might have a longer transition of 10 to 12 months. It just depends. La Crosse County is kind of going through the same process that we are, and they use Family and Children's Center. So we kind of want to try to make it more uniform for Family and Children's Center to just make it easier, I think, overall to have a process in place of how this is going to look when we have the license, but they're doing the work. So we're going to probably be working really closely with La Crosse County and sharing policies and ideas and that sort of thing. Right now, I know you had asked about the consortium model. They're not biting on that. Let me grab my water. I wasn't surprised. And I think the more difficult thing right now is we have different prescribers. Back when we had the consortium, we shared the prescribers, the providers, where now they're struggling just like we are to get those. And we actually have two good prescribers that work within our CSP program, but they're contracted individually or through the Trumbull County Healthcare Center, and they're not going to be willing to do work in La Crosse County. So that complicates things when you have a consortium model. It's just, and then they're going to be responsible probably for more work with policies and billing, and I just can't get them to bite on it, I don't think. So
Thanks for checking.
we're going to figure it out and then hopefully work together and make some things easier for FCC and make this work. The intoxicated driver program. We had a lot less assessments in Q4, and really not sure why that was. I talked to community counseling a little bit. They noticed it too. So I reached out to Jeannie and the clerk of courts and asked for some data. And there's some correlation there between the number of assessments and OWI charges going down. The other thing that plays a role in those numbers is not everyone in Jackson County that gets charged with an OWI is from Jackson County. And those assessments have to be done in the home county. So if there's a high number of individuals that are not from Jackson County but get charged in Jackson County, we're not going to see that number reflected in our assessment. So I hope to bring some more data to kind of compare with the annual reports.
That it's going down is good.
Yeah, it went down significantly in 2025, I think, as far as the total number of assessments, but 2024 was a really odd high year. And I just want to look at that more and kind of analyze it more before I bring all that forward. So I thought the annual report would be a good time. Jeannie was really helpful in getting that information for the last 3 years. So hopefully we can kind of see what's going on there. Additional updates. You probably saw we have 2 billboards going right now with the crisis numbers, 988 and our local crisis number. One is by Arby's and one is on the interstate by Hickston. We also did something different this year. We had some prevention funds left, and we are really trying to get that caregiver youth connection going on. We also don't have a lot of options for substance-free activities for individuals. So what we did is we purchased some family passes and individual passes from Lunda and open it up to county residents to come into our office in the month of December to pick up a pass or a couple passes to try combat the winter blues, but also give an option that of an activity that promotes overall wellness, that's substance-free, caregiver youth connection. So we had a decent response to that. We have some left, so we might do that again in February. And then I think the other thing that was nice was that with that was people had to come into our office. They had to see that we existed, make a connection with us, and know that we're here. So if they have needs in the future or just needed some other resources, they know where that we exist and they know where we are right now. So I think overall that went really well. We also had some statewide recognition for the All Abilities Playground. The Wisconsin Park and Recreation Association recognized the playground with the Outstanding Park Design Award for $500 to $1 million category. And for for those of you that maybe weren't on the committee at that time, we were able to get a $600,000 grant to pay for that playground, and that's why the plan went to, I think, 1.2 million in the end. So then we did some outreach at the Osseo School District. And then we were also awarded a $750 grant from Tyson's for the wellness extravaganza this year. The other thing that we're working towards is the state went all electronic for the licensing for many of our programs like the clinic prices, CCS. So we're trying to navigate that system. They've had some issues, so working through some of that. The other thing I added as kind of like a special topic on this quarter, I thought it was kind of fitting since we're talking about reporting, is how regulated the division is. I kind of just outlined how each program within behavioral health is regulated, the results for the last 3 years or whatever we had. I don't know if people had questions about that. I don't want to go through everything, but we're pretty regulated as far as a lot of our license programs like the clinic crisis, CCS, go through a biannual review, or what we call a survey, where the state auditor comes in and looks at the program, goes through records for staff, for clients, make sure that we're hitting state statute requirements. The CLTS program and the Birth of 3 program go through yearly audits. And all of that's taken place this year in 2026. So we're going to have a busy year. But it's kind of, I guess, rewarding when you can sit in the meeting with them and kind of hear the positives about the programs and I guess get those reports. And as you can see, we've done very well the last 3 years or so.
I just had a quick question. I'm sure we talked about this when this happened, but why did the Birth of 3 program move from public health to behavior? Is that just a statewide?
No, it's the Birth of 3 program is in various units within the state. So some counties have it in public health, some have it in the AES type of unit, some have it in behavioral health, some have it in like a youth division. So it all depends. I think the thought was it's better with the CLTS program.
There had been a long-standing conversation about wanting to do it.
Okay.
And then when our Birth of 3 coordinator left us, it just was kind of ramped up a little more timely to think, well, maybe now is the time to transition.
Okay.
And Tammy and Jessica worked really well on that transition from department to department. Behavioral health has been very welcoming. So
Just wanted one more program.
yeah.
Oh, we got to see a seat.
She was begging Tammy.
So when we say we're running out of room, we had to do Dr. D over here because we're running out of room. And then lastly, the client experience. I did something a little bit different this quarter. This was some positive feedback that we got from the wellness extravaganza. One of the stations was really about that caregiver youth connection. And they were able to do a bingo card for the rest of the summer. And in doing some activities together, they could cross off squares on their bingo card and then turn it in if they got a bingo or blackout at the end of the summer for a chance to win a Lunda Center membership. And so we had some of those turned in with a nice note from one of the participants. So that's always good to hear. Questions? Always all good.
Thanks. We have the National Health Week proclamation.
Good morning. What I had was in your board packet was proclamation for our National Public Health Week. That is the first full week in April. And I think it's been some time since we brought this forward. And this is something that our department would like to do annually. However, this year is April 5th. the theme is Ready, Set, Action. We still don't have details on what each day will entail, but in the past, we have celebrated by having trivia throughout the county, giving away some gifts that we got through preparedness. We do walks, we provide healthy snacks, we do some scavenger hunts. We've done numerous things during that week in the past. So it is something that we celebrate every year, but just wanted to get it out there and
Really with the, benefit of just raising awareness as to what is public health.
yes, and public health is more than just 10 people in this building. It really takes a whole community. Appreciate your support.
So we get a good turnout. When you have all these activities.
Oh, yeah, it's usually within the building or the county.
Okay.
The trivia is always a hit. So we've got other, like Sheriff's Department is huge. I mean, they're very competitive. So we get things like that. We one year did offer some trainings. I think it was Narcan and there was something else. Oh, okay, sorry. We offered a few things in the evening for community members that we didn't get much turnout for that. But they were focused training.
Well, and we have Facebook page now. I mean, turning to electronic ways of disseminating that information in bite-sized pieces. It's always been really fun to see that camaraderie amongst the county, because not every department in the county has an opportunity to celebrate or to then, work with their other county members to build awareness of their unit, of their department. And that's been, AKA the competition with the sheriff's department. That's really great.
On Facebook, we usually do some sort of campaign that's really kind of short and sweet to kind of just get a short message out there to our folks. Our Facebook page, we have almost 10,000 followers, and that blew up because I think in a strategic plan many years ago, I think our goal was 800,
Right.
and then COVID hit and we blew up. So we do, we've kept that. We've lost a few followers, but we still have a pretty good amount. So again, we share stuff from other parts of other units of the building, Sheriff's Department, things like that. We also have a website, and so we put things up there too.
We work on Camp for TikTok.
But it's interesting you say that because Josh is really into the real sort of thing. And when Amelia we can look at our Facebook page and see who follows and kind of, get an idea of demographics and things like that. And one of the things we noticed is that we got more comments or more hits on just a picture. A picture and some short versus the reels. And I think that goes back to like Jessica and I talking way back when is if people don't have time, they don't sit there and watch a whole reel for
Well,
a
and if
minute.
you talk to your 18 to 30-year-olds, they're not looking at Facebook for the most part, 25 especially, that younger prevention era.
But then it has to be something quick.
Yes.
So not, a minute or 2 minutes, because even I too, I'm waiting for this cat to jump through the hoop and it's not doing it in 10 seconds, I'm moving on. So those are the things that Josh has to, I think, gonna be working with Amy on WIC stuff and our prevention things and stuff. So that's always, social media is always complicated, but definitely something we need to do.
Go ahead, Tom.
Just
Just clarification. Is this proclamation geared more towards internal awareness within the county? Or is it geared more towards public awareness to involve the public with public health?
Both.
Yeah.
Both.
But we primarily get more participation from in-house.
Internal, yeah, we have, like I said, we do our things through social media. We try to hold some things in the evening, which we didn't have a lot of turnout. But in the past, it's been mostly internal, except for our Facebook social media. This year, we're just in the beginnings of planning. What we always tend to do too is we had blocks. So we would have, we would put signs out in all areas. So we'd have like a hiking trail in Maryland, we have a hiking trail in Melrose. We'd have a little area for folks to do a little walk, and then there'd be some sort of, as they met each place, there'd be a little thing about public health and educating and that sort of thing. We used to do that too. Yeah, and either we'd have really, really bad weather, so people weren't doing it, or people steal our signs. So,
Do you partner like with Jackson in Action and?
Oh, yeah.
And stuff like that to, like the walks and?
Yep.
And
Jackson in Action is out of our public health department, so we lead that. So, yeah, so we certainly, like I said, we're just starting the planning, of what we're gonna do this week.
I vote for geocache and TikTok.
I will totally get on board with the juke.
Yeah.
I don't know anything about that, do you guys? Well, Josh. Okay, Ben knows it, we'll make that happen. All right.
So looking for a motion to approve. the
Which is the board.
Second.
So did you?
And I second.
You second.
I'm gonna abstain. No.
All in favor?
Aye.
Opposed? Proclamation is approved.
Anybody with good ideas, just get them to Ben.
Yes. He leaves in August, so preferably before August.
So now we're going to archive a couple of policies.
Yes. So the first one is the public beach posting. This is one, as you know, we're going through our PMPs and updating and that sort of thing. And this was one that was created some time ago, and Ben went in to update and it was almost impossible. So we're getting rid of that one completely, and then I'll be presenting the beach water monitoring one after. So the public beach one, it will be completely, but replaced later.
I'll move to archive this.
Any question? All in favor? There we go. And then the family daycare, is that yours?
Family daycare certification, back in the day, public health, years ago, started doing the child care certification. And when John Mitchell started that, we had 30 some folks that we were monitoring. Kathy Rumsey took that over. I guess I should say John and Christy shared that. And then Kathy Rumsey took that over, and just we know there's a childcare shortage. It dropped to 4-ish that we had, and decided that the little bit of money that we get to run that program, that it just goes to the parenting place in La Crosse to oversee that certification. Because by the time you stayed up to date on that website and did your 4 visits, it was a lot of time and energy, and that time. So a couple of years ago, it actually went back. Chris took it on, and she would just go down to the parenting place once a year to do their audit with them for Jackson County. So it's been out of public health for a little bit. So, and it's not coming back. So I'd like to archive that one.
And I can see that.
Yes, Brady.
I'll move to archive the family daycare certification.
We have a second.
I will second.
Any question? All in favor?
Aye.
Opposed? You're archived.
Thank you. This next one, the beach water monitoring, this is the one, like I said, is replacing the beach posting. And I have the expert here, Ben, who does this sort of thing. He wrote the policy and put it together. So if you have any questions, I do have him to answer if I'm not able to. But basically, it's the first policy, we didn't do the testing. We are now doing the testing. And so on the back is a list of who we do test, and then also who's responsible for that beach testing or beach posting. So if there is something that's high, then the property owner or agency would be posting that. Ben, you want to add anything to that?
So the only thing we've done recently, once this gets approved, is we reached out to City Point for Spalding, as well as we reached out to the clerk for Millston. And so we're looking to add more posted water bodies for swimming to this list. So there's hopefully anything that's like publicly posted as a swimming beach should be tested. And so there's going to be a couple more added to the list. But when we put this together, we did bring in a committee. We brought in the sanitarians from Clark County to help us put this together, to do a lot of testing together, as well as our forestry part. So we definitely got their input before we put this together to clarify the roles and responsibilities of who's testing, who's collecting, and then who's posting once advisories and closures get out there.
Something that I think is kind of unspoken in this policy, but I think it behooves us to just mention that we don't talk about enforcement on posted property, posted beaches, and I mean, we're not planning to change that, right? I mean, it's information to the public, enter at your own risk.
Yeah.
Sort of thing. So
It
we're
actually
just calling
says-
law enforcement to, because people will complain, and they tattle on each other. And I can imagine board members getting a call saying, this beach is posted and I saw families doing such and so, what are you gonna do about it?
We wouldn't enforce that. That would be the property owner if
Right.
they chose to do that. So it must have decides that they're gonna enforce that with Lake Lee if we get them on board. Also to mention that we do the water testing. So obviously they're partners, but we do the water testing.
And as far as I know, on county properties, we really have law enforcement's aware, but we've never enforced, we've never said
Right.
auditors to pull
So-
people out of the water.
As far as enforcement goes, I guess I wouldn't use the word enforcement. What we're responsible for is posting the advisories and the closures.
Right.
But beyond that, we're not gonna drag somebody back out of the water if it's closed, but the notice is there.
But we have received phone calls saying,
Yes.
so-and-so is in the water and somebody should do something about it. So 4 board members, just so you know,
And Ben has been out there testing for our algae blooms and people stop to ask him what he's testing for,
Yeah.
like
Yeah.
it's safe. things like
yeah,
that.
so that's really our enforcement is when we get those calls that offer, I mean, I know I've sent out additional information to people to say, well, we're not gonna pull someone out of the water, but here's additional information or a site you can go to better educate.
And we've definitely seen that over the last couple of years, especially with the inclusion of the LG torch.
Yeah.
Is they see us there with this really unique device, and so we get a lot of public attention as soon as we get to like Lake Wazi or Arbutus. And so we get a lot of community outreach just in the field while we're collecting these samples. So it's an educational piece when we're there. And then when we do have those results, we can relay that education to anybody at the beach at the time. And we do take a lot of phone calls too.
Lots of,
And stepping back, so when you were deployed last, we actually had a 6 family that had a cabin up on one of, not the big lake, but like a backwater. They lived in LaCrosse County. And so then Heidi went out to the one overseeing that and they put her on a pontoon and went to visit all these areas. But we did go to door and give them information on that because we actually have some. So we wanted them, and it's not just family, it's animals too. So if you have dogs swimming and stuff like that. So that was the other situation where, like I said, we had an actual family that was sick. So we went door to door and took it.
And then another addition for this year, talking with Clark County, since they do border us, we did draft a equipment loan agreement. So once they sign that, bring that back to us, they will have access to the LG torch. It covers the liability, the use of the equipment, the cleaning, the maintenance, everything on their end, so the legal aspect of the equipment, but they'll have access to it, so they can also start incorporating their water bodies for algae blooms.
Are they paying us for that? Huh?
For the
They use
use.
equipment?
So there's no rental fee. It's just an agreement to use the piece of equipment, but the liability, the equipment maintenance and anything that would occur if they were to have it would be in that agreement.
but
And
when
it's
we have
been
an
reviewed by
outbreak,
the
we're
Corp
calling
Council
them
as
and
well.
they're coming to help us with something.
Yep, so their Corp Council, our Corp Council both reviewed the document that be legally binding of an agreement for the equipment.
And what does the torch cost again?
It was a 13,000.
13,000. Yeah.
And we purchased that when Kathy left, we had extra preparedness money. So
I was just thinking about replacement.
yeah, so I put the ask in. So it's extra funding because that was something that I wanted, then. So and they okayed it, so we can. But yeah, if they were to break it or something, I'd have to
I guess my main point was if board members receive a call, just know that more information can be made available, but we're not going to drag anybody's family member, ex-family member out of the water because, they're putting their kids at risk and that kind of.
And I think the line there of enforcement of the beach closure shall be at the discretion of the property owner manager, so that covers.
It does, it does.
So then we would be able to say.
And to
But
talk
thank you
about,
for your.
and to talk about what the county has done in the past
Right.
as an owner of that property.
Any further questions or discussion?
I'll move to approve this policy.
Wait a second.
Second.
You can take it.
All in favor?
Aye.
Opposed? That is approved.
Thank you.
Make sure Clark County knows 13,000 if they break it. Mention it every time, maybe more now.
Yeah.
13,000.
Small print.
Right. It's 13,000.
Right.
What's it for? Could be 21. So we're going to discuss artificial intelligence.
Yep, so this is the policy that I brought last month, and Tom had recommended reaching out to our county IT director, and I had the opportunity to do that. And he responded that they have only recently started working on their AI county policy, but we're waiting until the spring conference of the GIPA document. I'm not sure what that stands for, so I can find out for you. But I'm assuming it's their state county, or excuse me, state IT. Meeting. But he did have his employees review our AI policy, and they said it's sound. So really it's, do we wait until the county establishes their AI policy, or are we okay moving forward with our local DHS policy at minimum for our own staff here? And my recommendation is I would like to see something in place to at least our staff, but you do know that the county is working. And knowing that he feels that it's sound and that he has no major concerns, that it will fall in line with what they're establishing as well. But if there's something that does not align, we would correct it once they do establish.
I'm still in a position that we should wait for the county IT policy. And as I'm looking at your IT policy here, I'm seeing in the second paragraph where it says, however, no, all caps, underline confidential information, including personal identification information, or anything would be processed into AI. So when you go down to procedures and updates, you get into some of the common uses of publicly available IT uses are not limited to drafting emails or memos reports, summarizing documents or meeting notes, very general, case management assistance, summarizing case notes for easier reference, generating templates for clients, providing initial guidance and policy, appears to, if you're using AI to summarize your case notes, there's personal information in the case notes. So the top paragraph, the second paragraph of the policy conflicts with the publicly available uses.
So you, as I understand it, you can utilize it as a tool without putting an individual's name and personal identifiable information in there, but utilizing it to produce, yes, these kind of assistance that's not identifying that individual.
What staff would do would put plugins or leave it like a general term, and then they can copy and paste it into the charting system and then put that more identifying information or keep it gender, to use pronouns and things like that. I do think, I gotta pull it up in front of me, but I think that we adjusted it to make sure that we don't have anything right now, as sort of a program that, we use to help with documentation, but I think that for the future. So I think we were trying to make this future ready, that it would allow us to have a type of program that would be HIPAA compliant to put that information in there if we go that route eventually. But right now, we're just talking more about those general instances where we could use general information, help develop the note and then change it to be client specific once we put it into the APOD.
Brandy, if I could just add to, I was just at a financial manager meeting, had a presentation for PCF. And they actually will have contract language in our state and county contracts regarding AI. So there might be stuff that'll even supersede our policy, because they're gonna say that we can't put. It's almost anything that is not a published public statistic from DCF cannot go out on a public AI and it's a violation of our state contract. So we'll have to look more at our contracts when they start coming in, but just.
So if this was adopted now, it would be a living document and it would be revised from then.
Yeah, just like.
Since it's so new.
Yes.
Okay.
Yeah. Yeah, my worry is that we don't establish any guidelines for our employees and we allow them to utilize these tools. And we're not setting ground, established rules or groundwork as to the parameters of their use.
So like we don't have any prohibited actions, that's even more probably important, giving direction about what can't happen. I know it's not a very big section, but I don't know if it makes sense to pull anything out of the first part, but really, it seems like it would be great to give staff some guidance about what not to do. But maybe that combined with what to do answers the question that Tom has in his part of what Jess is saying.
Another concern in the language, it says, prohibited uses of AI tools, letter A. AI tools shall not be used to alter official documents or pictures without authorization. Why are we loading pictures into AI? Once they're out, out there, but I mean,
What does it do, you mean?
once you put anything into AI, it's out there. And I agree with Brandy's point about we need to have something that prohibits use of AI, especially in this bill. That pertains to juveniles and mental health issues. And when you get into using OpenAI, ChatGPT, Gemini, that once that information is out there, AI rapidly harvests all of that and it's out there and used to build the intelligence of the AI system. So it's one thing if you're using Grammarly or Copilot to help you with grammar and spelling. It's quite another if we're putting data or putting it's a very dangerous. It's a very helpful tool. I use 6 different versions of AI for my projects, so I understand. But never, ever, ever load personal information into AI. Or even if you redact it, AI has the ability to unredact it based on layering technology and stuff like that. So I'm an advocate of using AI because I think that if we don't learn to use it, we're behind the 8 ball significantly. But I agree with you, Brandy. It needs to be more about what you can't do with it. And we need to make sure that every employee knows that cannot make a mistake and put personal information into AI. Because once it's there, it can be harvested by anyone. So I guess something's better than nothing. But like you say, Desiree, it's a living document that will need to be amended and probably amended frequently until we get in front of it, because AI is evolving so fast.
And that's why I'm looking forward to see what the county establishes. I'm wondering if they are going to hone in on each department's utilization of AI, because we do have clients as opposed to, other
Parks and
departments.
forestry maybe.
Right,
or-
and so, but as with any county policy, it's generally very broad, so that's why we tried to focus ours a little bit more, obviously to our employees, but I am looking forward to see what they say.
Well, what do they say about timing for a countywide policy?
All he mentioned was that he was waiting until the spring conference, but didn't give any dates of when to expect. But I can reach back out.
I mean, it's a simple fix to remove, Tom, you're in accountability. The first thing is to say, if you're concerned about photos at this point, and again, as a living document, this can be altered next month or 6 months from now or whatever, but to remove with permission, so we're not doing anything with photos.
That it says that, though, basically, you're not putting photos in to alter that.
Says without
Yeah,
authorization.
but I think, Tom, correct me if I'm wrong, that's what you're concerned about, is the authorization aspect of it, that we should not be
Not
utilizing it
You
to alter.
shouldn't be uploading photos at all.
Right.
It's one thing if you're using Canva to generate a report for us. It's quite another if you're using it in your case management scenario where you've got pictures of bruising, or you're like, I can't tell what instrument was used to create this bruise on a child. I'm gonna put this into AI to see if AI can help me generate what it was. Was it a belt buckle? Was it the reverse end of a fly swatter? What was it? If you couldn't tell, and that's where I get concerned about uploading photos.
Well, in this living document, we could remove the words without authorization. So AI tools shall not be used to alter official documents or pictures. Or you can say, D can be no pictures will be uploaded, clearly, no visuals. I guess our choices are either to wait until spring and Ken has something that, he's been further educated, and we can look at what we have, or we could send this back to Brandy to have a little more redaction of things in the first half, other than prohibited, that we might want to wait on and not give any general guidance, maybe specifically to case noting. Just disallow it until 6 months from now, or, the spring is over and we bring this back and then address that issue to get something on the books. I don't know if that would be helpful, but
Jessica, you got a comment?
I mean, Chair. So in the HR realm of things, in each, as of late, each recent training that we have, they're telling us to hold off on an official AI policy. So what I would offer, and maybe I'm being able on this, but I don't know if this has been reviewed by Port Council or Weld Riley or Bob Reason and Roper, but I would certainly recommend that if it hasn't, and go from there. But it's very exciting stuff, but very scary as well.
Brandy, just curiosity, how did you create this policy?
And working with Monroe County. And working with Monroe County.
So this kind of mirrors their policy.
Yep, so they have this one in place as well.
And is it just for their DHHS or is it for their entire county?
Should be for their, their health services.
I would propose that we take the policy as it is and refer it on for further review based on Jessica's comments about legal review, and see what we get back from that, and then maybe hopefully be able to not amend it at this point, not use it, just send it to them, state it, send it on for review, legal review. It doesn't hurt to wait a month. Hopefully, Weld Riley can get to it by then, or whoever's looking at it. Yeah, right? Say hurry up.
What do
And
you think Wisconsin counties will come up with a policy?
I do.
But how long do we want to wait for something? If our intent is to give guidance to employees that's safe and at least is part of a living document that can be improved upon, but not, not make any major mistakes, I think bring it forward and then let's just see what legal response we get to this. I think it would behoove us, given that we don't have a county-wide or a statewide policy, nor do we have guidance from state contracts yet, to have some legal oversight, and then we can decide.
We're just acknowledging the fact that our staff are currently using AI. And they're using it countywide. Everybody's using AI.
And that's why we don't want to wait till December to get something.
That's exactly. That's exactly. But I do agree with you on, and Jessica, that let's send it to Well Riley and get a legal basis on it first, and they're the subject matter experts on, is it okay to put your case notes in and have them evaluated or whatever? Let's let them make that decision, so.
Yeah, I'll
Intelligence as a
take
board.
that, yeah.
Okay. Business services.
Vouchers for the month of December, we have $544,986.83. I'm gonna start with page 3. There was a payment for $5,000 to Interfaith Caregivers, and we do have an MOU for that payment with Interfaith. There were 2 payments for Adult Protective Services for 2 individuals in care, and one was for $365 a day at Trumbull County Healthcare Center, and then we have $176.81 a day for Country Terrace of Wisconsin. I did want to point out on the same page, page 3, that Lynn Gates did authorize October and November reimbursement to the Jackson County Veterans Office for rides as well. So they did receive $1,864.80 for October and November, and then they will receive some reimbursement for December as well. So it'll be a total of $25.83 to round out 2025. On page 4, you'll see a $2,000 charge to Lamar, and that was for the billboards that Jess had updated you with in her behavioral health update. On page 5, we have several stays. Those are all our CCS clients, and those are the room and board charges at Brodalock, Deer Path, Trumbull County. We did have one Winnebago charge for $2,166.
Carly, backing up to page 4 with the line with this. What is that money that we're using grant money for that? or-
Yes, that is grant money,
Okay,
reimbursable grant.
thank you.
Moving on to page 6. We did have some purchases in CCS. One was for some office furniture. We do receive reimbursement for that. That's for the Elon Financial Services, if you're wondering what that $1,633 was. Then the $85,000 is our prepaid to La Crosse County for our CCS contract services. And then the $13,421 is for the doctor fees and the admin fees for our consortium. Underneath the Children's Community Option Program, there's $18,774. That is for our children's long-term support waiver, maintenance of effort with the state. We pay for that through our CPAP funds because we're able to have that reimbursed. Is that once a year? That is once a year. But we use reimbursable funds, which is monthly. Page 19, we move last page. We do have 2 youth in residential care.
a couple high cost placements, one at Lab Lake and one at Rawhide Youth Services. Lab Lake is $768.66 a day, and Rawhide is $772.78. Was there anything else that you saw on the vouchers that I answered questions?
What is the justification for that high?
For residential care and. County that can show what all the services.
Yeah, they're receiving like numerous services, so it's a 24/7 obviously facility. They're there for replacement. They get their education there, they get individual counseling, group counseling, family counseling, they're doing skill work, and it's centered more around the individual.
So it's really intense.
Yeah,
When I worked at Sunburst, they were higher.
More than $700.
Yeah, but the care level that they were getting, with prescription and nursing care, education, field trips within reason, because they are at-risk kids, so they have to be careful of extra staff because they're volatile kids that'll take off running in the middle of the night to try and escape and send staff out to find them. It's expensive to maintain something like that.
So do we have any other questions for Carolyn?
Motion to approve the vouchers.
Second.
All in favor? Opposed? Vouchers are approved.
All right, I'm gonna move on to the fiscal report. We're 100% through 2025. Revenues as of the end of December is 11.6 million, and we're at 86% of our budget. We do have quite a few revenues that are still going to be trickling in. So we have revenues from October through December, all the way through every fund that we're still waiting on. ES all the way down to aging and disability services. So we have quite a bit that still needs to come in. So I'll continue to update you as the months go on here. Expenses as of the end of December are 13.6 million, and we're at 102% of our budget. AMSO is at 91% and 1.1 at 1.1 million. Just something to note, we did significantly overspend in CFS placements, specifically subsidized guardianship. But subsidized guardianship is something we receive 100% reimbursement on. We budgeted about 190,000. It'll kind of play into our next talk about placements. So we budgeted 190,000, but we've actually spent thus far, and we still have enough monthly expenses to come in 327,000. We get that fully reimbursed. So yes, we are overspent on budget a little bit for the entire department. Again, I'm going to continue to watch it. We've got lots of revenue still to come in. Another thing in CPS is we have, that they're over budget on preventative supports for families. So visitations, parent educations, counseling, all of those things, all those costs have just skyrocketed. They've gone up, and we're providing more of those services. So I don't know, it's just something we're going to have to take a look at in the years to come.
I have a question. So in the gray box there, you said 2025 budgeted fund balance. So we budgeted to use 1.1 million for 2025. We haven't used any of that yet.
It hasn't been applied yet.
Really?
So it's not reflected in the numbers.
It is not reflected. I wanted to make you aware that
Yeah.
it is likely we're probably going to have to use some of it.
With what we don't use goes back, right?
Correct.
Would we hypothetically grow our fund balance then?
Hypothetically, yes.
Okay. Yeah.
We'll see.
Yeah. Okay.
Moving on to the placement report. So placements are 92% of the year. We use a 13-month for the year because we still have one more month of placements to pay for in 2025. So we paid for those and paid for December and January. So children and families is technically at 123% of their budget because we're awaiting $186,852,000 in subsidized guardianship.
Where does it come from? Is that Medicare and Medicaid?
It comes from DCF, so it comes from USAC, and they only pay us quarterly. So
These Department of Children and Families
Yes.
from the state. And what are these like, they're state budgeted funds or federal budgeted funds? or-
Yeah, I mean, I can't, it comes through their 4E funding and they pay us on a quarterly basis and it's the whole process. So we pay the providers and then the check numbers get released and then once they have them all released for a quarter, then they give us that whole sum of money and they give it back. So as long as the process flows.
I don't want to get us into the weeds a whole lot here, but so at the state level, do they have a Department of Health and Human Services, or is it Department of Health Services and a Department of?
Children.
Yes.
Yes. Yes, it's very sad.
Oh, so they don't have a Department of Health Services. Yeah, they have DHS.
They have DHS
They have the Department of Human Services, but that's Department of Children and Families.
and then they have the DC, which is the Department of Children.
Oh. So you're working with two, so we're one department, but the state has two separate departments.
Two
There's-
regional directors that I work with because of the HSAs.
Okay, but the federal government has one, DHHS, right?
Correct.
Yeah,
But then there's also the Department of Public Health as well. So
well, it's a separate department. I thought that was within Department.
it's
of Health.
very sense, yes.
So public health is not DHS.
Well, they are, but they kind of operate separate too.
That's kind of goofy because you think, because EMS services operate through DHS and you think we're not public health. Whatever.
They
Get away from the weeds
They
here.
don't all talk together.
They did not get together to set up their programs the same, and it changes.
100%.
It changes every 10 years.
Really?
Often, yes. We weren't always the Department of Health Services, we were a DHHS, and then we became
And then they
state.
split off.
And then they split off, that's 10 years ago.
Oh, okay.
Politics.
Yeah, I work with DHS a lot, but I don't know anything else that goes on.
Like the Department of Children and Families would be like, child welfare and those kinds of things and child support. And, yeah, and then aging, yes, but it's still kind of under that DHS umbrella that they're.
Yes.
It's a big problem.
Thanks for checking that. She's actually the DCF regional director.
Okay.
So I continue to work with her, but yeah, so she can approve. But it's.
Wow. Interesting. Where are you looking?
So when do we expect all this money?
It's usually around April. It's always just when the books close, just push it back with the auditors and it's a mess. So.
And start charging penalties.
It'd be nice, right? Wish you could do that with your taxes, too. You borrow the money all year and want interest.
Yeah.
Right.
Adult protective services is at 77%, so $76,953. And behavioral health is at 95% of the budget, it's $289,200. And thankfully, behavioral health, I looked and I think I've gotten all of their institutional billing for the year, and they did not have anyone else. Should stay. Yes, they stay. So. That's what I got a little bit.
Any further questions you comment? Thanks, Carl, for the report. So we're going to discuss the reporting.
Yeah, so based off the discussion last meeting regarding the reporting proposal, it was recommended that each manager provide you with what they are currently reporting on and if they have any recommendations for you as to what they could add to their reporting. And so our request is that hopefully you have an opportunity to look at what they've provided and see if there's any changes you'd like to see to the data presented or formatting or anything along those lines based off our conversation. And please, if I missed
I
it.
think that the metrics tabs that you included in this month's report is very, very helpful to me anyway, to understand what is reporting. Because again, in the proposal that I made, it's me guessing at what's being reported. And I think not know what's being reported. So now it's just to be able to create the report that tells us what that information. So really quarterly.
Yeah.
You know, and
Because this
I
thing
agree with you.
changed so much in 30 days, doesn't give you true track record of anything.
And I agree with you, Harold, if we're looking for averages.
Yep.
I think quarterly is fine. It's just to get it formatted on what the numbers look like. So like Max, pointed out that we look at budgets. We don't look at day-to-day operations. That's not our job. That's what we hire staff for. But we do need to know what the budget numbers are. And I think quarterly, that is, because that would give us 3 reports in order before we get into budget cycle, when we are starting to look at budgets and we can see where we're at, where we need to bump it up or where we can cut it back. And so I agree with you, John. But I think it's very helpful that the metrics were added in here. So we can see exactly what it is that the standards are that they're mentioning in like the audit reports. I guess if there's something that flags in an audit report that you want us to know, you see the audit report, I just need to say that the audit was completed and we passed. But if there's a notable event in there, note it, but outside of that, I don't need to see it.
And they would be sharing if we did not pass in a certain area or meet America. So, yes, absolutely.
Yeah, so then, and it goes through several tiers before it gets to us. They'll go through the unit manager, having discussions with their staff. Then when they bring it to you, and then be the director have any discussion if they're not meeting expectations. Before we see it, maybe it's resolved before we even see it. So it's just, I think it's important that we get the data and the reporting so we make better and more informed decisions on where we're at. It'd be nice. But I agree with you. Totally.
I know as when I was village president, I instructed all the heads. I says, the 2 letters or phone calls I don't want to get is one from the DNR and the other is from the state of Wisconsin. Because either one is I'm usually the third in line, because because of things haven't been taken care of.
Yeah.
So, you gotta trust your employees, but I gave them a directive prior, this is, if there's a problem, I wanna know about it.
Must verify.
Yes, yeah.
Randy, I have 2 questions. One is, when you look at the offerings from each unit, so these are things that are currently monitored by unit managers.
Yes.
Right? None of this is new, I guess is what I'm saying. It's not new work. It's things that are already collected. Okay. I'm still looking at some of this and thinking there is a lot of data here. And I really don't want to see a widget report. I'm not really offering a solution, but I guess what I'm wondering is, this is a little more than what I thought Tom had proposed initially. And I'm wondering if we can pare it down to not see every little thing that we monitor. What are those focus points that we're concerned about? Maybe not even across units because every unit is different, but go back to unit managers and say, what are the things that you think the board needs to know most importantly? So if you could pick, focus on 6. I guess I'm kind of getting back to like public health. Tammy put forth some stuff that is really, I'd like to know where we're at with CHIP and what we've done in the last year or the last quarter to move us towards our measurable goals. But there is a lot of widget data here that maybe even quarterly doesn't really lend us to know a whole lot more than month numbers. It's nice in that it could come out in, to your point, Tom, in a very concise report, but I don't really want to look at widgets. We've done that.
No, I prefer summaries.
Yeah.
And I agree, Ellen, if we can condense that down, but, with the staff and Brandy did exactly what we asked them to do. Is that they give us a list of
What they track.
everything that they're doing,
Hmm.
which is what we asked for. And now it's to decide, okay, do we want to be flooded with every operational detail of DHSS every quarter?
And we tried that
No.
before.
No, I think that would be too overwhelming. I just think that the things that have budgetary impact and simple compliance reports, where are we at with overtime? Where are we at with our comp time? Where are we at with, troublesome areas? Are they getting feedback from Wild Riley in a timely manner? Are they having issues with, is there something that we can do as a board to change the rules or add tools to their toolbox that helps it be more efficient and streamlined? Versus, coming to me and say, okay, I wanna add this new position. And I don't have any metrics behind it saying why we need to add it. I mean, we can get a narrative saying that we want to combine this, or we want to create this, or whatever, but we don't have any data to back it up, whether we need to expand our staff, reduce our staff. I don't know, but I need to see that's kind of what I'm looking for. And that's why the initial format, certainly not this detailed, but I very much applaud the staff, because this will be very helpful to me. As I
What
go
is
back
monitored?
and look deeper into it and say, okay, these are the things, but from an oversight perspective, what do we really need to look at? Because a lot of this, I don't want to minimize anything that our staff are doing, because they're doing a shit ton of work. And I don't want to minimize that. I don't want to create a system where they get bogged down in additional reports, but there's basic data that I want to see.
Well, and when you talk about things like overtime and, workload, I struggle a little bit with, is that something that we hear out of a more centralized approach? Or do you really want to know that unit by unit? I mean, to some point, obviously you lose 3 staff and you have people doing all kinds of comp time. That's more interesting, knowing about it as an operational standard of that unit versus maybe a way that we might see payroll. But, and you're right. When I look at these reports, and I know a lot of this information has been monitored for a long time, we've seen not quite this level, but reports that really take this info and put into a graph, and you get widget reports, and it's mind numbing, and it really leaves you not really being able to offer any kind of oversight or assistance or feedback. So what out of this, I'd be interested to hear, for the people who read through this, what sorts of things they're interested in. Otherwise, I'd have to go back to the unit manager and to Brandy and say, you guys pick the top 6 that are most important to your unit.
Can I add like how I did mine, just because you mentioned public health, that, the CHOT strategic plan, when I do my presentation, I usually talk about our CHOT, where we're at with that and our strategic plan. So if that's not presentation, obviously I would, that would be part of this. I think when we're looking at Dominic and making that a permanent position, the human health hazard numbers, the time that Ben is putting out, that's probably the information you guys need. However, when I look at this, I looked at our accreditation goals and reporting. This will probably be in a dashboard. I feel this is a work in progress, because I don't have this at my fingertips as to how many this, how many that, but I can easily find it. But I think this is a work in progress for us, and then hopefully that it will go into a dashboard as we eventually get into accreditation. So then it's a little easier to read.
So Tammy, when I'm looking at what you reported as the things that you monitor, are you proposing that all of this information would come quarterly to the board? No. Okay.
This was kind of everything that I could think of, and like I said, a work in progress. And I had put it together. I didn't even go through a spell check. I sent it to my supervisors. We're just chewing on it right now.
Yeah.
To see what that would look like, because we do our presentations, we don't, and like I said, I have a whole packet of what our neighbors do. And it's anywhere from widgets to narrative to presentations. There's nothing solid. Pierce County does their dashboard, but that is because there's and that works for them. And so, I was just pulling stuff together. It was timely, like Tom knows, but this is potential stuff that we
To
can
choose from.
together.
And again, that's why it was introduced as the specialist proposal. So we evolved. You know, and it's, you know, because my preference, you know, and again, it's just my preference, but I like the idea of each unit establishing 4 goals for the year, one of the goals being efficiency. I don't decide what those goals are, but when you do set the goals up, that they're measurable goals that get reported to us quarterly. How are you doing on the goals that you set, presented to us? How are you doing quarterly on achieving those goals? And, you know, the goals certainly should be meaningful versus just say, well, I came to work today. We score 100%, you know, but I think then it helps us, and then it helps us in the second stage of it, where it just helps us. Are you audit compliant? Yep, we sure are, just had it, or we're not, and then you tell us what we're not or what we need to do, and then how are we doing on our payroll statistics? So we're watching our money, but you know, Max's point about the county is, we're here as oversight to manage money, not to tell them what to do day to day. But we need to know some type of performance metrics in there, how we're doing. How we do that, up for it. Maybe someone else has a better idea than that, but I don't want to see us having, you know, get something dropped on us at the end of the year saying that, you know, we're significantly over in budget on this because of something that occurred earlier in the year. I'd rather know about it, like you said, when you told your staff. I don't want a call from the state, I don't want a call from the DNR. You can make sure I know that ahead of time. That's all. That's it.
You know, to me, when I look at financials and look at where we are in the year, how many percent we've taken out of that pile.
Yep.
And then I want to know what potential problems they see, what potential areas we need to look at.
Yeah.
That's
Kind of a risk analysis.
yes.
Yeah.
You know, what can we change to make it better for you and for the program? You know, that is, maybe it's real, maybe very basic. That's how I am.
When I hear you talk, Daryl, I start to think, you know, Tom's talking about like 4 areas, and maybe they're the same for each unit, maybe they're not, but you might have one that is on goal, you know, a goal setting, and maybe you have a couple of goals within there, then you have a risk analysis, and then you know, maybe you lump all that into two or three things.
Yep.
Subcategories, because a lot of this is programmatic, and it lends itself more, as Tammy's getting to the point of a presentation. Let's hear about how Township went, but you could have a block that says audits or, you know, oversight. Do we have any failings? Do we have any successes? And I'd like to see a quarterly report that I could read and understand and not have to have a full presentation then. So we're getting that update, can independently understand it, maybe make recommendations about things that we should add. It's a working document. And then from that, still have presentations to things that are bigger.
Yeah, and if we just, you know, put something like in the agenda that we review the reports and accept it.
Where there's an opportunity for questions.
And yeah, you know, we do that a lot. You know, Jeff does it at full county board, is we get committee reports at the end of the board meeting. Is it in detailed on everything that happened in every department? God, no, we have to relive it again. You know, but it is helpful to get that information at the end of the meeting, because otherwise it's, in our case, 7 people making the decision for DHS. And the other 19, the other remaining board members have no idea. Not a clue.
There have been, resolutions and things that have come to the county board from a committee that I'm not on or whatever. Not on a lot of them, and I have no idea what I'm reading. So I can't justify making a decision on that resolution with any sort of integrity. So, yeah.
Well, I think historically, the biggest impacts on the budget are the detentions. And over the years, we've only had to pay levy dollars one time because it got larger than we anticipated. If we look back, they're very good at building their fund balances. We've 3 or 4 times have given money to the county to help offset the county budget. So to me, the biggest impact would be detentions. The other thing would be if they need a new person for some reason. And the other one that kinds of gets us is they want to change somebody's grade. So if we could look at areas like that.
It is unusual. I was thinking that too, Ron, that so often in our budget control, it's not about, as much as a lot of our costs are driven by labor, buy a lot of things other than services. It's really the services that drive the overages in the health and human services budget.
So 85% of the county's budget, roughly, is wages and benefits.
But not so much here.
Percent is services.
I bet we skew that.
You're talking about the overage aspect of
Yeah.
it, when we do go overage because of placement costs.
Yeah.
But it's still 85% of this budget is wages.
True, but if you're not paying out overtime and you're comping in time and you're not hiring, to Ron's point, new people or changing their pay grade, that's a pretty confined cost.
Is it?
The way the system is set up, it should be. I can't see how you're around it unless you start paying out overtime, which historically has not been the case. Our bigger risk is not doing prevention and having to pay for more services that are out of control. I think back to when we had to get money from the county, and that was really, how many years ago was that? 10 or so, but that was really what drove that budget crisis. I'm not saying that, you're talking about wanting to hear about changes in programmatic things that drive maybe needing a new person or changing how the structure of the employees within a unit is made up. That's important to know. I'm not sure that that is the ultimate financial driver for issues or problems that come out of health and human services.
Yeah, well, at the end of the day, it involves us having to answer to a taxpayer.
Yeah.
Why are we spending this money? And I really want to know what that answer is so I can tell them that.
And that's a helpful thing to say.
And I can give them general terms of why certain things are, cost beyond our control, placement things. There are certain things that there is no way for this committee to budget for. We can do our best guess, and that's the best we can do. But if we get a high cost placement that's going to be there for a year, and we're sitting at $1 million, and they ask, where's all your money going? Well, we can tell them that $1 million goes to take care of one individual person. But what about the rest? What's the rest of the story? And I'm not saying that DHHS does an outstanding job at being only roughly 29% levy dependent, I think. I don't know if that was last year, I think. And the rest of it's all on reimbursements because of preventative, because of how we do prevention care versus high cost placement care. And then, but there at some point in time, we have to take a look at that too, is saying, where's our risk analysis when it comes to that? Are we doing too much prevention, not enough prevention? I don't know how to gauge that, but we need to, ultimately, we run a $42 million budget this year, which is $2 million less than last year. But people on their taxes this year saw the most common was 11% increase. And they immediately say the county board is pissing away money. You know, we've seen from decisions that we made the other night, that there are people mad and don't think that they know what the hell we're doing as far as making decisions. But they don't understand that we've reduced the budget by 2 million. And then equalized value comes into play. And other taxing agencies come into play. And it's not cheap to run a county to provide the level of services that they've grown accustomed to. So if they want us to continue to reduce the budget, to reduce their property taxes, that means we're gonna cut services. Okay, then I'm gonna ask my constituents, what do you want to give up? None of them have an answer to that.
And I think for public health, and I think Jenny's department, she'll be like, we're mostly levy. So we try really hard to find grants and things like that to offset that. But again, too, we're levy, but we're also statutorily required. So it's one of those things, but not all our services are. So, but for the most part, I mean, we're a department of 10, but we're very conscious of.
And yet, Tim, we see that from Carly, and the fiscals give us that. We do have breakout by, by unit.
Yeah.
So we're getting that on a monthly basis where the units are. If there'd be a sudden spike or something, I guess you have to think about what it was last month, and I would hope that Carly would let us know. So it's really getting back to Tom's comment about programmatically having a little better understanding about what are those pinnacle things that we are monitoring to say that we are good stewards of the money that's being spent. A big piece of this is financial, and I feel like we get that financial piece. We do a lot of financial stuff every month. We talk a lot about into the weeds and have all opportunity to look at over expenditures. But I guess what you're saying, Tom, isn't even so much that, it's more about changes within the system or risk analysis or goals that we're striving towards.
We get the program return on investment.
Yeah.
We go and look at this.
Yeah, the program
this program.
changes that are happening throughout the year to then why are we asking for a new individual, new position? Understandable. I think I'm on the track of what you're trying to get to. I think currently we'll continue with how we're reporting, but we're going to work on something more standardized that includes the things that you all have discussed. So some of those concerns regarding budget, where we might have issues in the programs, where we might need a new position, or maybe take away a role, goal setting that you mentioned, the risk analysis aspect, giving the audit updates, but including where we can make improvement, and then any concerns that those departments are having that we would like to ensure that you're hearing. And then getting your feedback on, or maybe how it's affecting the budget, things like that. So if you're okay with that, we'll continue to work on a standard.
Absolutely.
I think that sounds really good, Brandy, and that, if you could see that by unit on a, something that comes out to us a week before the board meeting to review and think about, that will drive a lot of good conversation, I think, and should give us some of the things that Tom was thinking.
And then that would be on a quarterly basis, and we're receiving it. To then lead into budget, and then give you some of that background for our requests.
That's not going to be an easy task to boil it down to that, but
Especially when she's.
yeah, easy for you to say.
I was already on it.
And, and like Tammy said, when she was looking at our surrounding areas, everybody's different.
Yes.
Okay, so maybe we take a compilation of what everybody else is doing and what their boards want to look at and throw some of that into the mix. Also, not to make it more complicated for you, but in some cases, where if someone's doing it well and it's working and they can see those performance metrics and they make better fiscal decisions and policy decisions, I'm all for it.
I think another thing that we really need to consider from a board standpoint too is just efficiencies on our end, because there are so many units and so much activity that we need to have something that is boiled down and, yeah, meaningful, because if we had very long reports that they're looking at every quarter, no one's gonna wanna come to those quarterly meetings.
But again, remember, we're not asking
That level of
everybody to
detail.
present them.
Yeah.
Every quarter, it's on an iPad, you
Exactly.
can look at it.
Yeah.
And see, and if it's something that flags for Brandy and the chair. And when they're looking at those reports, going, we better talk to the board about this, make them aware of it,
I think we would
bring it
move
forward.
with that, like to your point, Ellen, I think we would move away from each department providing their larger presentations, and you would then be receiving these on a quarterly basis,
Yeah.
giving them the opportunity, if anything stands out, then you're having that conversation with them. And then also, Tom, you mentioned outside of those quarterly reports, that if there are concerns or things they want to provide information on, they can still do that.
Yeah.
Absolutely.
But this gives us, so one of the comments I did have heard from the manager is that we just want to know what they want to know. We want to hear from them what they'd like to hear from us. And so this has been beneficial to give some.
Very, very much so.
Is the answer to that, we don't know.
We don't know. I think you gave some great.
Yeah.
Advice, you talked about the goal setting, risk analysis, those types of things are very helpful.
Yeah, things that we can take to our constituents that we can teach them because we understand it. Right?
Yeah.
And that way when they're, up in arms because, the budget's gone up again or their taxes have gone up, you can say, well, this is why you want us to fight to take this away from you.
Well, we're gonna move along because I have a medical appointment.
You have a hard stop at June, right?
Oh, there's a nurse right here. There's two, all your medical care right here.
Actually, it's.
Oh, no.
So
Have had good enough insurance.
we can discuss unbudgeted grants.
Yes, so we have two today. So behavioral health has the state crisis intervention program or SKIP grant. And Jessica, I'm gonna pass it to you just to give explanation on that.
Yeah, so this grant is out of the DOJ. It's not one that we've applied for before. But we were able to apply for up to $100,000 and we got within a couple dollars of that amount from the populations, but looking at using it on unknowable crisis follow-up time. So the time our staff takes to follow up with people that come through crisis that might not have Medicaid, or we might not be able to bill a Medicaid source. And then other things like suicide prevention and outreach activities within the community. So we have, things like gun locks, campaigns around with billboards, whether it be crisis numbers, those importance of securing guns, things like that. We kind of have a variety of things. It's really a short period of time that we have with the grant. It's only March through September, so we had to be really creative on what can we accomplish during that time, knowing that all of our programs are going through audits during that time. And we have other activities and things going on, client care, of course, too. So we had to be really conscious about what we could actually accomplish in that short period of time.
How much money did you spend?
$100,000.
Jessica, is it consistent with the policy or the goals and objectives of your unit?
Yes, of course.
Motion to approve them.
Second.
All in favor?
Aye.
Is there another one?
There, business services, we don't usually hear from business services for these grants, so, $10,000 from USAC for Nova.
So, USACUS has a Title IV pass grant that you can get up to $10,000 for. Last year, well, in 2025, we implemented an interface between our accounting system and the Department of Children, Families, and USACUS program, so that there isn't any human interaction between the provider payments and our accounting system. So we're not manually entering those checks anymore. So basically, our system is pulling down all the information, putting it into whatever accounting batch needs to happen, and it's cutting the checks. So they're not pulling down the information and manually keying on that. That was a state requirement. They told us we had to do that by the end of the year. So we had budgeted to do it anyways. We had budgeted some roughly $195,000, but the project only cost us $49,207.20. But then the state offered a $10,000 max reimbursement, so I did fly over them.
I don't think we should do
Okay, we have a motion on the floor. All in favor? Opposed? So the next agenda item is to discuss the interim director.
So, we had discussed, because there will probably be an opportunity where I will not be in this seat, having an interim director. And so I do have a recommendation, I'm able to share.
I would, versus getting into people specific, I think that we should just, because it borders line, it could get into complications with employment HR stuff. So, my preference would be is that, well, I'll just make the motion. I make the motion that the oversight chairman, the administrative coordinator, and the HR director get together separate from this and make a decision, taking Brandy's recommendations on who she thinks would do a good job as filling in as the interim director. And we just let Ron, Cindy, and Jessica make that decision. And that way we're out of the weeds with any potential conflicts with knowing a person, not knowing a person, closed meeting, open meeting. So that's my motion is that we just leave it to the chair and to Cindy and Jessica, and they make a decision with taking into consideration Brandy's recommendations for an internal applicant.
May I ask a question?
Yes.
I just want to ensure that with that recommendation, that Jessica and Cindy have no concerns with that.
With that process, you mean?
Yes, with what Tom's recommendation.
I do not from an HR employment standpoint.
And as Cindy.
Cindy, you okay with that?
Yes.
I'll suck it then.
Ron, are you okay with that?
So is that and then is it a timeline when you do an interim director? Is it through like 6 months or until a permanent one's hired?
Until we hire someone. Yeah.
Oh,
Did you want that amendment?
no. I don't think we need to complicate this. Yeah.
May I also just, or maybe I need to ask questions after that's voted on.
Okay.
Okay.
So all in
Can I
favor?
ask a question?
What was that?
You have a question?
Yes, I do. So the interim director, if I'm assuming it's someone internal that would be appointed to that, their pay would change also according to the comp guide. So should that be part of the motion to allow the three of us determine the pay range based on the policy?
Yes, I would add that to my motion.
I will second them. So I can provide you both a little insight while you're discussing this. For the compensation administrative guide, there are a few exceptions, right, to how we determine placement on a wage grid. And one of those exceptions is an interim director that's appointed by the oversight committee and then approved at the executive committee as well. So part of that approval, right, is that rate increase. And so the guidebook provides for a minimum of step 1 of the grade in which the DHS director is. So in grade 20, step 1 would be the minimum. If, let's say, the interim individual is already at step 1, they could see step 2, okay? But it would be no more than a 25% increase on top of their rate of pay. Just so you guys are aware.
And that's why we hire subject matter experts.
So if we pull this from us internally, would they be conducting both their current position and assistant director?
Hence the extra money.
Okay, that's good. So
They'll be busy.
might as well set up a con here, right?
And subject to a mini mental exam.
Free of postmodels for me.
Yeah.
Gift cards, right?
Probably
Concussions.
would be well received by that individual.
So any other discussion on it? Yes.
I should have added this as well. I'm sorry to interrupt. What I would offer, and obviously Cindy and the chair and executive committee would need to approve this as well, but due to the timing of this, obviously it's not ideal, given kind of the legislative process and how things, how long things take to come through, committees. What I would recommend, possibly when we get to that point where we're saying this is the individual and this is the rate of pay and it needs to be approved by the oversight committee and then the executive committee, is a retro back to that effective date, written within that resolution. So I would just offer that.
Thank you. Yeah.
So we're good to go?
We're gonna vote.
All in favor?
Aye.
So now we have a director's report.
Sorry, I didn't bring the printed. Apologize. Just gonna put it on the screen. So just some quick updates, open positions, my position, behavioral health licensed treatment professional 1, 2, 3, and then child support. We do have a child support specialist position open. That was approved by Ron to go ahead and post for that position. Just so everyone here is aware, if you're not already, that position was held by Cindy Jefferson, and she is now our emergency manager. So very exciting. It's just the county emergency manager. Just some upcoming events. 26th January, we do have our ADRC advisory meeting. That was moved from this past Monday to the 26th just because of the holiday. On the 27th will be the Emergency Preparedness 2026 Regional Exercise. So I know that's something that Tammy and Molly are excited for and amped up for.
That's here in Jackson. We're all saying good.
31 January is the due date for nomination forms for Women in History. And we know that that resolution was just read in. And so we hope that we get several nominations. If approved, we'll have our next DHHS board meeting on 18 February. And then the next day is Community and Cuisine at 5 p.m. here at DHHS.
Aren't you forgetting a date in February?
I know. Yeah.
Oh, the 3rd? Really? So you won't be here for our February meeting then? No. You have to zoom in.
No.
This is like Motel California. You check out one of these lines, can't.
Oh,
Family.
I did have a question about the Women in History nomination forms. Is there a certain period of time in which we can nominate women, and do they have to have already, like, what am I trying to say? Like, can we nominate people recently for recent contributions, or does it have to be a certain year?
No, it can be for recent.
Okay.
We select 5 every year from what we've got turned in, and we keep them for 3 years. So even if they're not selected this year, they get put back in the randoms or the nomination committees last year.
And when do you inform individuals if they are nominating someone else who's already received, or
Again.
so if someone has already received that award, do you if someone calls and says, "Hey, have they already received this?" You let them know. Okay,
Yeah.
okay.
And they're up at the courthouse too. That's true. But we do have a quite extensive list each year we put out of who has received them. But
Has Fallon received?
she has to be 60 and over. So not even-
Oh, there's a limit.
Oh, that's right. It's a problem.
Never guess it.
I thought you were all
Sorry, not. There you
Yeah.
go.
It's Ron, I don't have to guess, I can tell you.
I dare you.
You want to be excommunicated?
No.
Rest in peace, Tom.
What is
Nice
the-
knowing you.
You want to adjourn that?
I'll adjourn, yeah.
All right.
Oh, see, now we're in the minutes line.
Went out, I was waiting for the right.
Yeah, yeah. People look at the minutes. Jesus.
Brandon.
I use,